Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thanks for tuning in. And if you follow our channel, you know that I'm a cosmetic facial surgeon in Richmond, Virginia, and facelift surgery is my passion. I only do head and neck surgery. I don't do boobs, bellies, and butts, okay? And today we're going to talk briefly about the aging face versus the youthful face. Now, the point that I'm going to make, and unfortunately I'm a great example, okay, is that the aging face, we get square. So you look at somebody that's, sometimes even in the early 50s, their face starts to get square because you have the jowls. And there's not a person that's over 40 that hasn't done this in the mirror. And what happens when we do this? Why do we look better? Well, our face is heart-shaped, okay? Your cheeks kind of fall down and become your jowls. And when we smile, we look younger because we have volume here and we start to see this taper again. So what does a face and neck lift do? Well, it does exactly that. Above the jawline, it lifts your jowls, and below the jawline, it tightens your neck. So I'm going to show you this in an example on a patient, and then I'll show you some before and after pictures to make the point. And I really appreciate the greatest gift of all, and that's your time. I'm Dr. Joe Niamtu, LoveThatFace.com. Okay, and now we're going to take another look at this, and it's COVID season, so I'm wearing a mask this close to a patient. And what we're talking about is the difference between a youthful jawline and an aging jawline. And we're going to be doing a facelift on this patient. And her chief complaint is the same that mine is, except she has hair and can do a facelift. Smile real big like that. So when we smile, we always look younger, okay? Because the face is tapered. Now relax. And as we age, this just continues to come down, and we have a square face. And our goal is to make that a nice tapered face. Now, obviously, this is not 100% accurate, but it kind of shows you what the lift does. And when you see somebody that looks like this or looks like this, they've just been to the wrong doctor, okay? Because a facelift never should do that. A facelift should do this, and you're going to get the jawline back. You're going to get a little improvement in the nasolabial fold, a little improvement in the corner of the mouth, because the facelift doesn't do much in here. It's really from here to here. So our goal is to take this squared off face and make that into a nice heart-shaped face, which is a signature of youth. So again, as we age, we have the squared off face. And one good way to see what you'd look like with a facelift is to recline the patient, okay? And when you put the patient back, and if they lift their chin up, it takes gravity out of the situation and the tissues fall back. Now let's put your chin way up and turn that way a little bit. So you can see that the patient has a nice tapered jawline and a tight neck. So again, we have this nice taper. When she sits up, she has this squareness. So after doing almost 1,500 facelifts, I feel pretty confident laying a patient back and having them look in your mirror a second. And actually having them look in their mirror, you can put it down close to you so they can see it too, be able to see the mirror. And I think this is a good way for people at home if you want to see what you'd look like with a facelift. Now, normally, your cheeks aren't going to be quite this big, but this is pretty accurate. From here to here is pretty accurate. So this is what we do at consultation to show people what they would look like. Well, thank you very much for sharing your time with me. And now we're going to do a little educational presentation here on facial aging. Cosmetic facial surgery, especially facelift surgery, is my passion, and I do 2 or 3 facelifts a week, and we're in Richmond, Virginia. So we're going to talk a little bit about facial aging. So we're going to do a little educational material here. I've written 8 or 9 textbooks, and these are 2 of my most popular and most recent textbooks. The one on the left on the art and science of facelift surgery, and the one on the right, which is about facelift surgery and all other cosmetic facial surgical procedures. I'm very academic. I like to study, I like to read, I like to research, and I like to publish, and of course, I like to operate. So one of the things that is really important is to understand what happens in facial aging. So when we're young, our face is oval, heart-shaped, because our chin is pointed because we don't have a lot of fat down there. All our volume is up here in the cheeks. Now, obviously on a younger child, they're pretty chubby, but younger people look like an upside down egg. In other words, their face is tapered because all of their volume is up here in the cheeks and the skin is tight. So we have this nice tapered neck and tapered chin. Well, as we age, all this stuff, the skin stretches, we have heredity, we have aging, we have all these situations, and our face becomes squared off, okay? And that square face is like a right side up egg where the taper's at the top, but everything is stacked up down here on the bottom because it all falls and atrophies, and this is what happens as we age. So you have a upside down egg in youth, and you have a right side up egg in as we age. So it's egg foo young and egg foo old. Okay, sorry about that. So there's a lot of changes that happen as we age. One of the things is our skeleton shrinks. Okay, so as our skeleton shrinks and you have these bony changes, your skin becomes less saggy, right? Because we have a smaller supporting framework. Now, there are so many things that we can't control about facial aging, but there are so many things that we can control, okay? And so we beat ourselves up a lot. When we're young, we're like a grape, and that's the caricature on the left. And they're hydrating, they're drinking a lot of water, they're using sunblock, they're protecting themselves from the sun. So, we're tight and we don't have all of this damage when we're born. And if we take care of ourselves like this, well, we're going to stay more youthful. However, many of us, we do everything we can to accelerate our aging, smoking, drinking, laying out in the sun without protection. So we do our own damage, okay? And then the other thing that we can't control, the joke is, well, you picked the wrong parents, is our heredity. So this is a picture of my son when he was younger, picture of me when I was younger, picture of my father when he was younger. I don't know, this picture's these are about maybe 10 years old, but it goes to show how we go through this nice pointed, tapered, youthful chin and neck, and then as we age, it starts to square off a bit. And then as we get elderly, we have this square face where we have lost the taper totally. So that's kind of some of the really basic mechanisms of facial aging. Now we're going to look at some before and after facelift cases that I've done. And this is a lady we did a facelift and a chin implant. So you can see we've really rejuvenated her face and neck. This is a patient with a much bigger facelift and has this extra skin and jowling, or this turkey waddle, and you can see how we have improved all of this, yet still kept an age-appropriate rejuvenation, which is important. The goal is not to make a 60-year-old look like they're 30. It's to make them look the best that they can for their age. And when you see people trying to push that too far, that's when people look fake and over-tightened and over-pulled. And this is the patient that I just showed you. This is her before, and this is her after. So you can see how nice her scars are. And I really have studied this hard and tried to do everything I can to perfect a predictable outcome for scars. And I'm really proud of the scars that I get. That's before surgery, that's after surgery. So really an imperceptible scar. Um, Here's another patient with similar type aging. So we have this jowling and all this extra neck skin. And after the surgery, we have a nice rejuvenated neck and straight jawline without that big jowl. And again, this is that patient's before and after. So this is only 2 months. This is before, this is 2 months after. And the patient was from out of town, so she happened to stop in. You can see her scars are still a little bit red. Before is here, after is here. But those are going to blend in and do well. I usually wait at least 3 months before taking my after pictures But I see so many out-of-town patients that a lot of times I'm lucky just to get an after picture. Another patient who had just excessive skin and fat buildup, and on people like this, you can remove that skin and liposuction that fat and really have a nice rejuvenation and a great result where you've gotten rid of this jowl and you've gotten rid of this turkey gobbler type neck skin. And this is the before and after of the scars of this patient. That's before, this is after, this is before, this is after. Here's a patient I did cheek implants and facelift, and I think we did laser resurfacing. And again, we're looking at this jowl. You can see the improvement, this loose neck skin. And this is really the rewarding part of my job. I mean, I just love being able to make somebody look and feel better. It's just a great skill set. I'm so lucky that I have this kind of job. Here's another patient. And again, this patient's in her mid 50s, but she's just got this hereditary neck skin. The rest of her doesn't look that old. I think we did lower eyelids and I did cheek implants, which make a big difference in helping to make that upside down egg, make that face look more youthful, and of course, tighten her neck with the facelift. Another patient, just a lot of hereditary excess skin, and we did a chin implant to help her. So we increased her chin length, we tightened her neck skin, and got rid of these really big jowls that she had. You can see her after scar there, still a little bit pink, but really will heal well. Another patient who just had a lot of jowling and a lot of neck skin before and after. I did her upper and lower eyelids as well. Male patients, this is before. This patient had quite a lot of extra skin, and you can see the difference after the surgery, and you can see that the scar is really imperceptible here. Another male patient that we did face and neck lift on. So, as I stated, I have a passion for education. I teach courses at my office and have international attendance, and it's really great to meet cosmetic doctors from all over the world. I have an online video series that doctors can download and teaching the various procedures that we do. And also, I already mentioned my textbook. So I'm really involved in academics. I guess I'm kind of nerdy because cosmetic surgery is pretty much my life force and my drive. This is some of our courses where we lecture and teach. And, I'm giving this lecture here. This is August 2020, and we're right in the middle of this COVID crisis. One of the things that I really miss is speaking at meetings and conferences. And I've spoken on 6 continents and usually speak all over the world. And right now, it's all virtual. It's all Zoom. So I miss that. So in any event, I hope you enjoyed this presentation, and I hope that my excitement and passion for facelift surgery is obvious. I'm Dr. Joe Niamtu in Richmond, Virginia. My website is lovethatface.com. Our phone number is here, and thank you so much for your time.